A Cleveland Clinic study shows that among patients with obesity, prior weight loss achieved with bariatric surgery was associated with a 60% lower risk of developing severe complications from COVID-19 infection. The research was published in the journal JAMA Surgery. Numerous studies have established obesity as a major risk factor for developing serious illness from an infection of SARS-CoV-2, the virus that causes COVID-19. Obesity weakens the immune system, creates a chronic inflammatory state, and increases risk for cardiovascular disease, blood clot, and lung conditions. All of these conditions can complicate COVID-19. The aim of this study was to examine whether a successful weight loss intervention in patients with obesity prior to contracting COVID-19 could reduce the risk of developing a severe form of this disease. The research findings show that patients with obesity who achieved substantial and sustained weight loss with bariatric surgery prior to a COVID-19 infection reduced their risk of developing severe illness by 60%. The researcher says that their study provides strong evidence that obesity is a modifiable risk factor for COVID-19 that can be improved through a successful weight loss intervention. A total of 2,212 adult patients with obesity were included in this observational study. A group of 5,053 patients with a body mass index BMI of 35 or greater who had weight loss surgery between 2004 and 2017 were carefully matched 1:3 to non-surgical patients, resulting in 15,159 control patients. Compared with those in the non-surgical group, patients who had bariatric surgery lost 19% more body weight prior to March 1, 2020, the beginning of the COVID-19 outbreak in Cleveland. After the COVID-19 outbreak, researchers looked at 4 COVID-19 related outcomes: rate of contracting SARS-CoV-2 infection, hospitalization, need for supplemental oxygen, and severe disease, defined as a combination of ICU admission, need for mechanical ventilation, or death. Although the rate of contracting SARS-CoV-2 was similar between the groups, participants in the weight loss surgery group experienced much better outcomes after contracting COVID-19 compared with those in the non-surgical group. Researchers found that patients with prior weight loss surgery had a 49% lower risk of hospitalization, 63% lower risk of need for supplemental oxygen, and 60% lower risk of developing severe COVID-19. Although the exact underlying mechanisms are not known, these data suggest that patients who underwent weight loss surgery were healthier at the time of contracting a SARS-CoV-2 infection, which resulted in better clinical outcomes. The researcher says that this study suggests that an emphasis on weight loss as a public health strategy can improve outcomes during the COVID-19 pandemic and future outbreaks or related infectious diseases. That is a very important finding considering that 40% of Americans have obesity.